Welcome to Health CIO's interview with Denise Anderson, President of Health ISAC. I'm Anthony Guerra, Founder and Editor-in-Chief. Denise, thanks for joining me.
Thanks for having me, Anthony.
All right, very good. Denise, you want to tell me a little bit about your organization and your role?
Sure. So I'm Denise Anderson. I'm President and CEO of the Health ISAC, which stands for Information Sharing and Analysis Center. And just a little bit of the background on ISACs, the Information Sharing and Analysis Centers were formed under a presidential directive from President Bill Clinton in 1998. The concern at the time was Y2K, to get industry to share with each other amongst the critical infrastructure sectors and with government. And so the ISACs were formed and were paired along critical infrastructure sectors, which the U.S. has defined 16. We're in the health sector. The Health ISAC formed in 2010. I came on board in 2015 after a stint at the Financial Services ISAC, which was one of the first ones to start. Basically, what we do is we're a trusted community of organizations that touch the patient really in healthcare, and we're focused on cybersecurity and physical security so that patients can receive care and get it safely. And our membership is composed of various subsectors within the sector, such as labs and pharmaceuticals, medical device manufacturers, pharmaceutical manufacturers, of course, hospitals and healthcare delivery organizations, anything from a large hospital system to a small clinic, and then, insurance companies. Basically, anyone that touches a patient can be a member of ours.
Very good. All right, I like to start with sort of an open-ended question. What are some of the trends you're looking at? Some of the main things that you're watching, looking at, that you feel like your members want content around and direction and things like that. I guess you probably have a couple of things you focus on. One would be providing, and you tell me, providing your members with resources and information and content, and then also lobbying. I don't know if you're allowed to lobby or you can't lobby, but
We don't lobby.
you don't
No,
lobby.
we're not a lobby organization. No. So we're very operational in nature. So I like to say where the rubber hits the road. We're basically looking at the threat landscape that is out there, whether it's cyber or physical, and then we're alerting our members to the various threats that could potentially be something that they face. So, for example, in last year, we provided 274 targeted alerts. Those were alerts specific to organizations where they either had a vulnerability that we were able to detect, or that we saw their name on a list to be targeted. So that is an absolute value that our members would receive from getting those alerts. But we have general alerts as well, right? So as we're seeing vulnerabilities or threat actors out there, we're sharing that information with the membership. The members actually also share with each other as well. So when they're seeing things, they're sharing, what they're seeing, what they're doing about it, or if they're having challenges with doing something about it. So it's all about members helping members and the community helping the community, and that's really the strength of what we do.
So you are a specific source for like a threat intelligence feed. So they may have other vendors that provide them with other feeds for threat intelligence, but you are also another source, correct?
We're a source. I wouldn't call us a feed per se. We're definitely a source, and I would say that we're a highly vetted, highly trusted source because a lot of our information is coming from the members themselves. So it's what they're actually seeing.
Mm-hmm.
But it wouldn't, it's not necessarily a threat intelligence feed per se, although we do get indicators of compromise, right?
Mm-hmm.
So those are the email addresses, headers, hash marks that come in, and we do share those out. So we do have high fidelity indicators of compromise that get shared out.
Any thoughts on sort of main things that you think CISOs at hospitals are looking at, thinking about from your conversations with them and interaction?
It's interesting. I do think that those CISOs that understand the threat landscape are constantly watching for whatever could be out there. And it doesn't necessarily have to be something directly targeting them. It could be something that can impact the supply chain, for example. So, one of the things I talk about often is that you need to be thinking of every potential scenario and every potential situation that could impact you. And one of the examples I'll give is that during the initial stages of the war between Ukraine and Russia, there was a satellite firm that got attacked, and it took down their operation. What people didn't realize was that a lot of wind farms, those wind turbines in Germany, relied on those satellites to operate. And so it took down electricity in Germany and some other areas in Europe, also internet communications. And so those impacted operations.
Mm-hmm.
So, you have to be, even though it's not something directly targeting healthcare, you have to be very mindful of the landscape out there and how you can potentially be impacted by events that happen.
Yeah, mindful of things that can cause disruption sort of downstream. I looked at your opening letter from your report in 2022, and you really focused on resilience. Huge issue, sort of resilience, business continuity planning, recovering, or dealing with. One of the things that I've been focusing on a lot, the Joint Commission came out with a very interesting, I thought it was really interesting paper in August last month called Preserving Patient Safety After a Cyber Attack. It's all part of the issue of continuing operations in the face of a disruption to electronic systems. I'd just like maybe your thoughts around that. To me, that's just a monumentally huge issue. And the paper from the Joint Commission, when I read it, I was like, oh my God, it's like what you have to do to prepare. And the idea of going to paper, the change and what it requires is astounding and almost incomprehensible that it can be done. So it feels like this is a big, huge issue right now because we see more and more outages. We're seeing them left and right. Your thoughts?
Yeah, so I think the reality is that at some point somebody will be attacked. I don't think that you can or be impacted by an attack, whether it's on them directly or on a supplier or partner. And so you have to be thinking, this is back to my earlier comments, you have to be thinking of all the potential impacts to your organization and how you can continue to deliver what it is that you deliver. So it goes back to enterprise risk management and looking at what are the crown jewels of what I do, and what does it take for me to continue to produce or do those crown jewels, and for how long, right? Because it's not, sometimes many of these incidents can go out for months. So you've got to understand what potential impacts can be and how you can actually bring operations along those lines for a continued and sustained period of time. It's not easy, but I think it goes back. I was actually a firefighter EMT for 20 years, and when I was coming through the ranks, we looked, those old ADC map books. That's how we found an address. Now it's all automated, and that skill, we had to, we tested continuously. We knew all the streets in our area of response, and when the call came, we knew where to go immediately when we turned out of the station. That skill is lost because it's now all made electronic. And I think that's the same thing in the hospital, right? The old school doctors that were used to pen and paper, it might not be as hard for them, although it is an issue. I won't, deny that, but it would be a little bit easier for them. The younger generation who have been raised on the electronic communications and electronic processes of patient care, it's harder for them to adapt because they've not had that. That experience has not been there for them. So it is a huge issue, and it's something that people need to be very mindful of when they're looking at how to remain resilient and to continue patient care.
Yeah, you mentioned the time frame that we're sort of want a scenario plan for, and in the paper it was 4 weeks from the Joint Commission. 4 weeks, which is astounding
Yeah.
because I think the inclination for the average employee, maybe the average clinician, is okay, the systems are down, let's go to lunch, and when we come back, right, it's not to continue, it's sort of let's just wait for them to come back up because again, it's so inconceivable of how to move forward. you mentioned the preparation that's required. So here's a question, and this is something again I've been focusing on for a couple of years now as I have interviews with different CISOs. What is your role, Mr. or Mrs. CISO, in making sure your health system is prepared to deal with a cyber outage? Like, how far do you take the ball? And it's really interesting in that joint commission paper, which I would recommend everyone. They talk about it being under, and this has been said before, under the overall emergency preparation department or unit of the hospital, the one that prepares for a hurricane, anything. So cyber has to be under that. So my thought recently was the CISOs they can't just assume that this is being covered by emergency management. They have to proactively initiate discussions to make sure, hey, by the way, as you're doing Hurricane X and Y and Z and whatever, this is a real scenario and I want to work with you. I want to help you understand because you're going to run it. I'm going to be the key resource as you run this. So I think people need to think like that. They have to be proactive, know that they don't have to handle the whole thing if you're a CISO, but you have to make sure, do your best to get that under emergency management. Does that make sense?
Absolutely. I mean, that goes back to incident response and incident response management. And, like, as I said, as being a firefighter, they do that every day, right? It's running a crisis after a crisis. And they have a plan, they have a pre-plan, and everything is laid out. There's a division for finances, there's a division for logistics, there's a division for response, and they're all working the incident. Likewise, an organization should be doing the same thing. Cyber, I would argue, is one component of the crisis, right? So, like as you're alluding to, they would be the division resource for the cyber aspects or impacts of the incident. So, absolutely, there should be incident response management. It should fall under the enterprise risk management plan, and people should be prepared. I always say you should know your response, know your impacts, write a plan, have a plan, exercise the plan, and make sure that everybody knows the plan. Because when an incident happens, you don't want to be scrambling about who do I call for this or who do I call for that, what do I do? You need to know. And you're not going to be able to perfectly envision every scenario that can exist, but you can have plans in place that can attempt to get you down the response path.
Yeah, and organizations can't expect the CISO to manage everything about a cyber incident because it's going to stop at some point. Their responsibility is going to stop and someone else has to take over. So for example, you know, we can deal with the cyber element of it. We can make the decision about systems having to be taken offline, but the CISO is not going to make sure that the paper forms are there. They're not going to make sure the
Right.
printer ink is there. So if that ball doesn't get picked up by somebody else, you're going to have a huge gap in that resiliency plan. So it has to be enterprise level, non-IT, non-security, running the whole thing.
Right. And everybody needs to have a voice, right? I mean, everyone needs to be at the table because not everyone's going to understand all the consequences or impacts of an incident upon that particular aspect of the operation. So everyone's voice needs to be there, especially in the planning process. And that's, again, I'm a fan of checklists, right, where you're alluding to there would be a check mark. Do we have the paper forms in place? Are they updated? All that kind of stuff so that it doesn't get missed in the chaos of response.
Yeah, well, you're talking to the right guy. I mean, I'm the biggest, I'm a checklist guy. I'm trying to
Yeah.
teach my kids. If there's 11 things you need to bring to school, don't try and remember all 11 every day. Make a checklist
Right.
on your phone.
That's right.
Beautiful. It's so easy. Reminders, checklists, calendar appointments. This is how you run your life these days, right? Let's use the tools. But and they use that on the clinical side, right? I mean, there's all kinds of checklists in airlines, everywhere there's checklists. And the beauty of this stuff is when you establish a checklist or a process, you can continually improve it. You don't have to
Yes.
reinvent the wheel every time, but know that it's not set in stone. It's never done. It's always subject to
Right.
improvement. Is this not how we move forward in life in almost every aspect?
That's right. Absolutely. And I find sometimes right to what you're saying is we do many of these things. We've done it as firefighters, we've done it as doctors, where they have the steps in place for dealing with a procedure or an operation or whatever the case may be. But we don't bridge that gap and bring it over to other processes. So like we tend to do things in silos and don't think about, hey, we do this over here. Why can't we bring that over to this side and work it? So it takes a mindset where you're looking at, from above at the whole thing and then, being able to say, hey, why can't we use this here? It's absolutely something that we can absolutely do. And so it's a mindset.
Yeah, and I would just get your thoughts on this. It's not the CISO's responsibility to make sure the paper forms are there and the printer ink is there, but it is your responsibility to bring that to emergency management and just tell them, like, because you're at that level, you want the business to continue to operate. So you have to
Mm-hmm.
try and at least put the business in a position to be successful, which is again articulating this, voicing this, helping emergency management who they don't know cyber inside and out, helping them
Right.
understand these scenarios. They may not be thinking of these scenarios. Do those tabletops to say, okay, now here's a scenario where we're going offline. Right? I'm going to reach out to you in emergency management and say, we need to come offline in 2 hours. Now you have to go do a bunch of stuff that I'm not going to do. You have to do it, but they need to understand the scenarios. They may have no idea that things could go that way. Right?
Right. And I would argue that the CISOs don't even know everything either. I mean, but it's their job to articulate what the impact is, right? So you can't just say we're taking the systems offline. You're saying when we take the systems offline, this is what's going to happen. You're not going to have access to patient records. You're not going to have access to images. Those kinds of things they need to articulate clearly that here's what the impact of this action is going to be. Then the response team would figure out, okay, what do we need to do to address that impact? That's the start of the plan, right?
Yeah, and you mentioned, an article I looked at this morning about an outage. The two things you mentioned, one was, this is someone at the health system saying the biggest impacts were, number one, our ability that was impacted, our ability to do imaging studies and look at them in real time was gone, which is a huge part of diagnosing, right, clinical issues.
Right.
And that the second thing was the EMR allowed us to look back at old records, and that has been almost 100% taken away. So the two, those are the two big impacts that have to be thought through on the clinical side, right? Because,
Right.
and that's
Right.
why, they're diverting patients. And I made a joke the other day that if I knew my local health system was down or subject to a ransomware attack, I'd divert myself. You wouldn't have to worry about diverting me.
Yeah.
I would divert myself. But anyway, your thoughts about again, that's the clinicians having to think through what they're going to do. So it's
Right.
interesting.
Exactly. Yeah. I mean, you articulate what the impact's going to be, and then they've got to figure out, well, how do I continue my job with this impact? What do I need to do on my end to make sure that I can still treat a patient? And I mean, access to images is huge. I would argue when you're doing operations or anything like that, lab results. I mean, all of that stuff is very, very reliant on electronic records nowadays. I mean, that's just the way it is.
Yeah, let's switch gears a little bit. And I don't know how much you've been thinking about this, but I've just been reading a lot of stuff about this generative AI stuff and the security implications of this, and some articles I looked at recently talked about one of the big concerns is, I guess, people, clinicians, people in the health system doing queries. So you're going to do a generative AI query in chat GPT or something. So you dump some stuff in, right? You're dumping
Right.
stuff in, and then you're hoping to get some sort of response back. Well, there's concerns there that the dumping in part could be dumping in PHI maybe, or you're dumping in things and because you don't know if these things are going to pop up in somebody else's query because they're used now as part of the AI in its brain, so to speak. There's some issues there. A lot of people they're starting to roll this stuff out. There's a lot of thinking about this. Do you have any thoughts on this sort of generative AI area?
Yeah, I mean, I think so. Like anything, like technology, right? When we made things electronic, there are great benefits to it. So I think AI is going to bring a lot of advances, a lot of changes in medicine, really positive things, right? But it's also going to create a lot of challenges like anything else. So one of my concerns would be more of the disinformation
Hmm.
side of the coin, where you just alluded to people putting putting a query out and then requesting information back. I think if someone manipulates that and gives bad information that is potentially used to treat patients with, you know, so that would definitely be a concern of mine. I mean, I could see where that could be very malicious. And I think there's a lot of other ways, obviously creating personas, imitating personas for authorization to systems, those kinds of things. So I think that there's a lot that we need to be mindful of. I don't think it's anything, like over time, I think it's the same things we need to be concerned about, which is availability, integrity, and access. But it's just going to be in a different way.
Yeah, interesting point. It makes me think of that data poisoning concept
Yes.
that you have to watch out about. And I interviewed Christian Demeth, who's
Mhm.
a doctor into cybersecurity. We know him. He's well known with that paper about the regional impacts of a ransomware incident. So he's done some great work. And one of
He
the
has.
really interesting, when I interviewed him, one of the things he brought up was, he was like, think about this. Somebody wants to do harm through in a health system, and AI, generative AI, gives them the ability, if they're able to sort of influence prescribing electronically, and they want to do harm. Generative AI gives you ability to come up with a harmful but not obviously harmful prescription. So,
Mhm.
because there's things that would be complete red flags, totally ridiculous, no one would ever follow through on them. But there are ways to do harm less obviously, so it doesn't get caught anyway. Um, Data poisoning, a very interesting
Yeah.
concept. Any more thoughts about that?
Yeah, no, I mean, that probably is what keeps me up at night. I mean, imagine that a threat actor goes in and says, I've changed some records in your organization on blood type. Randomly, 100 records of your patients. Somebody that was a B positive is now an A negative. Imagine what that would do. Number one, they don't technically even have to do it, but even the thought of them doing it, how can you trust your records again, right? You're going to have to go back through and clean everything up. And but if they really did do it, think of the consequences of that action. Or they could then threaten ransom. Hey, I could tell you which of those 100 records I did it, but you got to pay me, so much money to get that information. So I definitely could see where that, or you got the terrorist aspect too, right? Where they go in quietly to do it because they want to create harm. That their motivation is for that. So that data integrity is probably the biggest issue for me, I think, because I think it doesn't take much to really decrease the trust in the data.
Yeah, great point. Great point. So, there's different ways they get in. There's sort of the technical way, really fancy hacking, right? I mean, really, really advanced. They really know their stuff from an IT point of view, right? So that's one way to hack in. That's requires a lot more skill. And then there's the basic phishing, social engineering, right? You don't have to really, you're just writing an email, email or phone calls or combination of researching people in on their social networks to find ways to make it seem as if you know more than you do. That's something anybody can do. So there's different ways, and there's arguments about which is more prevalent, but they're both serious. So at the very least, we want to stop people from clicking on emails, clicking on things they didn't, creating a nice cyber culture where people are sensitive to these things. So that's a big responsibility that all CISOs they want to do. They want to make sure they have a sophisticated cyber culture in their organizations where people aren't doing silly things and then dealing with people who make mistakes. And, I've heard many CISOs, they really don't want to take a punitive approach. It's just not the way they want to approach things. More coaching and it's been said, you should see them as a victim, not as a someone who's done, but there's a balance. There's always a balance because somebody who makes five mistakes, come on. It's right. At some
Right.
point, we change from patting you on the back and saying you'll do better next time to something has to change. And they have to work with HR and all these kind of things for dealing with these issues. But overall, your thought on how to create a positive cyber culture where people are thinking right. They say that, this is your biggest vulnerability is your people sometimes. So your thoughts.
That's right. Yeah, no, I absolutely agree. People is the low hanging fruit, and there is a reason why the Nigerian prince schemes still are around, right? Because people fall for them.
Yeah.
And you would think, what is wrong with you? How can you fall for this? But they do,
Right.
because they are totally engineered. So I agree with you. I think, we see this argument all the time in some of our threads about are you punitive or are you more educational in nature when it comes to employees and clicking on sample fishes
Mm-hmm.
or those kinds of things. And we see the gamut, but most people do want to take more of the positive approach, right? So I believe that by getting people to understand the impacts of clicking on that link and educating them on, why they shouldn't do it, because this is what's going to could potentially happen, that people will then think twice, hopefully, or at least have some understanding of their role in helping the organization prevent harm so that then patients can be treated effectively, right? So I think when you couch it that way, a lot of times you just get that same rote, don't click on links, look for this, look for that. But if you understand, wait a minute, if I click on a link and this is what could potentially happen, and maybe my aunt who's being treated on an operating table can't be operated on, it kind of helps put context around why they play a very critical role in helping an organization stay safe.
Yeah, and you just made me think about identity and access management. So we can't have 10,000 employees that each, if they click on the wrong link, can destroy the organization, right? You can't have that.
Right.
That's why we have rights
Right.
and permissions, and 99% of those 10,000, hopefully, theoretically, if they do click on the wrong link, there is a minor amount of harm, not that catastrophic harm, because they have low-level rights and permissions. And this is a huge area, right? Identity and access, a huge undertaking, not easy, extremely complicated. It's always changing,
Right.
but ideally, you
Yep.
want to have the minimum rights and permissions for your role. Everyone should have the minimum, and it should change immediately upon the role changing and the needs changing.
Yes.
That should flex, and it should be super tight, but it's way easier said than done when you have,
Yes.
again, these people are changing roles
Yep.
constantly, needing access, changing departments. So it's a massive, massive issue. But it sounds like, that's going to be key. Getting your arms around that's going to be key to minimizing damage if somebody does click. Does that make sense?
That's right. That's right. Absolutely. I mean, I argue that education is one aspect of protecting identity and access management. So, yeah.
All right, very good, Denise. We're almost out of time. I want to give you an opportunity for your final thoughts, and I'll couch it this way. Anything more you either want the folks to know about Health ISAC? I know you're very well known. Your entity is very well known and leveraged by a lot of folks. There may be some who either are new or just aren't aware what you offer, so and why they might want to become involved. So your thoughts around that, or overall any advice to the CISOs at the health systems?
So, yeah, I mean, I would be remiss in not saying, because I do consider myself to be an evangelist for information sharing, that we should be sharing information with each other. And shame on us for not doing it. There's various reasons why people don't do it, but it's so easy to do. And it's so beneficial. We have so many examples of where information sharing has protected organizations from harm, has protected the community from harm. And so I really, really encourage organizations to really think about sharing information with each other, with an organization like Health ISAC, with whoever it is that you think would be beneficial, whether it's law enforcement or any other entity, to do it, because it is. It doesn't cost anything. It's easy. Many people get hung up on the type of information that's shared, but really, to be effective, it's not as sensitive as people think it might be, right? Indicators of compromise can be very generic. And so I really encourage people to really share with each other, especially when they're seeing incidents within their own organizations, and how they can benefit from that. Because one day, we have this saying, one person's defense will become everyone else's offense. And that's really the essence of Health ISAC is the community, helping the community so that we can deliver effective patient care. Because we'll all be patients one day, or know a patient, and so we want to make sure that they get treated.
No, I think we'll definitely all be patients one day.
Yes, yes.
But I did interview John Rigi from the American Hospital Association, who I'm sure you know,
Yeah.
and he mentioned, this will be published soon, but he mentioned that there are certain legal protections when you share information. So,
There are.
And as you said, when it happens to you, sharing may not be the first thing on your mind, but you would want everyone else to share, right?
Yeah.
Because you would want to
Yes.
know to help. So, if we
Exactly.
can figure out a way to do it and have those conversations beforehand and figure it all out, we can be more comfortable, talking to legal, making sure privacy, because sharing will help.
Exactly.
Absolutely, right?
That's right. That's part of the incident response plan. I would love to see that as a checkbox on the list, right? Share information with Health ISAC or whatever ISAC you are in your sector, or whoever it is that you want to share with. But, that would be one step in the process, because to your point, when it happens to your partner or you're connected to them and they're not sharing information with you, that doesn't help anybody. So, the more we can prepare and are willing to figure out the ways to share with each other before an incident happens, the better off everyone will be.
And I love your point. It should be on the checklist. I absolutely love that, and I think it should be there. Um, every CISO's checklist, as they talk to emergency management, work through these things. You know, when it may not be the first thing you do, right? You're dealing with the incident, but when and how can we share for the benefit of other health systems? Absolutely should be on that checklist. So, great
Yeah.
point, great idea, Denise. A pleasure. Thank you so much for talking today.
Thank you, Anthony, for having me.